Welcome to Pediatric Podcast for PedsCases.com.
Hi, my name is Dr. Kai Homer, and I'm a resident in radiology at the University of Alberta. This video is the second in a series discussing musculoskeletal radiology in children. We're going to focus on musculoskeletal injuries and go through some cases to help you understand how radiology fits into the whole clinical picture. This video will discuss terminology used to describe fractures in radiology, specifically saltr fractures. This module is reviewed by Dr. Adrienne Thompson, a pediatric radiologist at the University of Alberta. I'd like to thank the University of Alberta Department of Radiology for allowing access to images from real cases. All images have been de-identified and are used here for educational purposes only. These slides are available at www.pedscases.com. After watching this video, the learner should be able to, number 1, describe the 5 types of saltr fractures. Number 2, use the saltr mnemonic to remember the types of saltr fractures. Number 3, identify the clinical complications of untreated saltr fractures. You may have already learned about the saltr fracture classification. This is a system used to classify different types of fractures involving the growth plate in the pediatric population. Here, I'd like to go over an easy mnemonic to help you remember how to use the saltr system in real life. The easiest way to remember this that I've found is to use the name saltr and make an acronym out of the letters S, A, L, T, and R. These letters correspond to the 5 types of saltr fractures. But wait a sec, before I launch into the mnemonic, you're probably wondering what the point of the saltr classification even is. Basically, kids get their own special fracture classification system to describe fractures that go through the growth plate. These fractures are important clinically because any fracture that disrupts the growth plate can compromise the blood flow to the growth plate. This can lead to premature closure of the growth plate, which can in turn lead to problems such as limb length discrepancies or radial-ulnar joint arthritis. If these problems develop, invasive surgery is usually required to help manage these kids' symptoms. That's why saltr fractures are important to catch and treat appropriately at the get-go. The letters will stand for the following terms: straight across, which corresponds to saltr fracture type 1, above, which corresponds to saltr fracture type 2, lower for type 3, through for type 4, and rammed for type 5. I'll explain why these make sense in a second. What's important to realize is that every type of saltr fracture, 1 through 5, all somehow involve the fracture going through the growth plate. The numbers help differentiate, for example, what other parts of the bone the fracture goes through, the angle at which the fracture line sits, and etc. In saltr 1 fractures, the fracture line goes straight across the physis and by definition does not involve the metaphysis or epiphysis. Here in the schematic, you can see the fracture line completely horizontal, going straight across being the S from our acronym, going straight across the growth plate. Here in the schematic, you can see the fracture line completely horizontal, going straight across the growth plate. Straight across is the S from our acronym. In reality, the fracture line may not be completely perfectly horizontal. This is just to illustrate the concept. This slide helps conceptualize the remaining types 2 to 5 of saltr fractures that we're going to go through. All 5 types involve the physis, but different structures are affected other than the physis depending on the type. Saltr 2 fractures refer to fractures involving the physis where a corner of the metaphysis is also broken off. Saltr 3 fractures describe when the fracture line extends from the physis into the epiphysis. Saltr 4 fractures describe when the fracture line extends through both the epiphysis and metaphysis, therefore crossing through the physis, which is the layer sandwiched in between the epiphysis and metaphysis. Saltr 5 fractures are unique in that actually it's only the physis affected, but the mechanism is specific to saltr 5 fractures. If the fracture line doesn't go outside the physis, a crush mechanism by definition makes them saltr 5 fractures. In saltr 2 fractures, the fracture line goes across the physis and above, breaking off a corner of the metaphysis. In Salter-Harris 3 fractures, the fracture line goes across the physis and below, breaking off a corner of the epiphysis. In Salter-Harris 4 fractures, the fracture line goes through the epiphysis, physis, and metaphysis. In Salter-Harris 5 fractures, the growth plate is compressed under a heavy load. The height of the growth plate is decreased, but there's no discrete fracture line per se. This is a summary slide that goes over everything that we've talked about. Let's go over a case that reviews concepts from everything we talked about so far. A 5-year-old boy is brought to the emergency department by his parents due to pain and swelling over his left wrist after a fall on the playground. Here we have an AP radiograph of the forearm showing the ulna and radius. If we zoom in here on the distal ulna and radius, we can see that the normal contour of the distal radius should be completely smooth. However, due to a fracture, here the contour of the distal radius has a sharp bend. This is the orthogonal view of the same forearm. Notice there's a focal outward bulge in the cortex of the distal radius and ulna. The question is this a fracture? Indeed, it is a fracture. This injury, which is unique to pediatrics, is known as a buccal fracture, which is the same thing as a torus fracture. They are synonyms. Interestingly, the side of the bulge is the side on which the bone got squashed. Buccal fractures most commonly occur at what is known as the metadiaphyseal junction, which is the junction of the metaphysis and diaphysis. An important differential diagnosis to consider in cases of a buccal fracture is a Salter-Harris 2 fracture. To pick up a possible Salter-Harris 2 fracture, you would look carefully for a fracture line in the metaphysis that extends to the physis. This concludes part 2 of this video series. In the next video in this series, we will discuss the approach to pediatric shoulder radiographs. Before we leave, we wanted to leave you with a few key take-home points. Number 1, Salter-Harris fractures are important to detect clinically because they can lead to serious complications. Number 2, all types of Salter-Harris fractures involve the physis. Number 3, the mnemonic SALTR will help you remember the different types of Salter-Harris fractures. Thanks for watching part 2 of the pediatric MSK Radiograph series on PEDS cases, and please stay tuned for the rest of this series.
Check out www.pedscases.com for more great podcasts, videos, interactive cases, questions, and more. Press subscribe on iTunes to get access to all of our podcasts. If you like what we do, please leave a review on the iTunes Store, share with your friends and colleagues, or think about getting involved.